Hi, I'm Dr. Ram. Today I'm here to explain a myth about heart. Many of us believe that when you undergo angioplasty or when you undergo bypass surgery, you feel that heart is permanently cured. There is all the ailments in the heart is cured, which is absolutely wrong. Whenever an angioplasty is done, actually it will only remove blocks that are major blocks. When the whole heart is predisposed to the whole heart, the blood supplying to the heart, the blood vessels supplying to the heart, all the blood vessels are predisposed to having blocks. So among these, the percentage of the blockade which is more than 70% is significant. Only the blocks which are more than 70% are actually treated with angioplasty or bypass surgery. So if the angioplasty or bypass surgery, the blocks which are more than 70% are treated, but the rest of the vessels which are predisposed to having blocks cannot be stopped with the surgery or angioplasty. So they continue to degenerate, and later on time many blocks will be formed at other places where angioplasty is not done or bypass is not done. So never be under the impression that whenever bypass surgery or angioplasty is done, your heart is done. Please try to be under a follow-up of a cardiologist and have your periodic checkups. Don't stop it. If you stop it, then there is always a risk of having a recurrent heart attacks. So whenever bypass surgery is done, many people after the surgery is done, they will only go under the follow-up of cardiac surgeon. Again, this is absolutely wrong. Cardiologist is a better person to treat your heart medically than a cardiac surgeon. So whenever a bypass surgery is done, once the surgery is finished, you should go back to your cardiologist and you should be under the follow-up of your cardiologist. And never stop medicine once the bypass surgery is done or once angioplasty is done. You should be on your medicines throughout the life. So mind you friends, angioplasty and bypass surgery are not a permanent treatment for heart. They are only getting rid of the major problem, impending heart attacks or curing the heart attacks. But your heart is prone for recurrent attacks, and your problem in the blood vessels are prone for recurrent blockades. So please be careful, follow your diet plans properly, use your medicines properly, and please have a periodic checkups and try to be under a follow-up of a cardiologist. Even a surgical patient who has undergone a bypass surgery should be under the follow-up of cardiologist, not under the follow-up of cardiac surgeon. And today's myth is about the backache. We tend to believe that whenever you have sudden severe backache,